had gotten a virus that attacked my heart, and this virus attacked my heart, and that first gave me the disease in the first place, and that happened in year 2000. And then from there I had heart disease as well as lupus, and that combination is not a good combination.
When Carla's condition worsened, she was rushed to the Ohio State University Medical Center.
By that time I was in desperate need of a heart transplant. The fear was real. There were other patients that were waiting for hearts with me, and 2 that did die. So the reality that I may not make it, and the fear that there are so many thousands and thousands of people waiting for organs. And I was just this one little number in a multitude of like 82,000 people waiting for organs.
After 3 long months of waiting, she got the news she'd been waiting for. A suitable donor heart had been found. But Carla's good news was short-lived.
I was literally on the operating table with the Swan life support inserted in me, waiting for that heart. So when the doctor gave us that word, the heart's not right, you're going to have to go back downstairs and take you off of life support and go back downstairs and wait again. I cried all the way down. As a matter of fact, I cried for 3 days.
At times, Carla felt totally hopeless.
And the fear when my children came and then they would cry, it was time to go, and they were tired of mommy being in the hospital, and I couldn't answer any of their questions. So saying, when are you coming home, mommy? It's been enough time. When are you coming home? And I couldn't answer their questions anymore. And it's like, I can't do this anymore. I can't do this anymore. I'm tired of the suffering. I'm tired of the pain.
And then her condition got even worse. Carla was placed on a 1A status. Doctors felt she was not going to make it without a transplant. We spoke with Carla's transplant cardiac surgeon, Dr. Binkley.
People who are status 1A have become ill to the point that we're concerned that they may not survive more than a couple of weeks or at most a month. And at one point, her condition had deteriorated to the point that she was classified as a 1A.
But even in Carla's darkest hour, the entire community reached out to help this woman that had helped others so much. And when her church decided to have a special program in her honor, something truly miraculous happened.
And that Saturday evening, when that program was being done for me, and when all the saints were getting together and praying, and as they say, when praises go up, blessings come down.
When her family and friends were praying, Carla felt something unexplainable happen to her heart.
7 p.m. that night, I felt it. I felt a change in my heart. A change that was so great, I had to call the nurse in. And she came in and she said, "What is it, Carla? Do you need more morphine?" Because I was on morphine at that time. I said, "No, it doesn't hurt. It feels different." And I couldn't explain what the difference was. Was it pressure? Was it... Still to this day, I can't explain it.
Medical tests soon confirmed what Carla's faith told her was true. Her heart was totally healed.
And they said, "Mrs. Bailey, we have something to tell you, but we don't know how to tell you. It seems like that your heart is healed. When it was measured 7 days ago at 16%, it is now at a level of 51%. It is total healed." And all I could do was say, "Do you think it was a miracle?" And they say yes.
Not only did her recovery amaze the medical professionals, Carla says the Ohio State University hospital staff was a strong spiritual support.
OSU Medical Center, can't say enough about them. The doctors, the staff, the nurses, the housekeepers, the dietitians, all lifted me up in prayer. When they came in my room, they were positive. There was no negativity. They prayed for me.
Doug and Carla say they've learned some valuable lessons from her unbelievable ordeal.
I think the thing I learned the most is, I guess, patience and purpose. You know, just being patient and just understanding what our purpose is, what my purpose is, what Carla's purpose is, and understanding that, the Lord works in His time. if we're patient and believe, things will be all right.
Well, you know what? God is your Father, and in my mind's eye, I see God as the Father figure, and He will bring His loving arms around me and keep me secure and give me a peace of mind and a spirit that will say, it's going to be all right.